Hi, my name is Francis Chen. I'm Professor of Medicine at the Institute of Digestive Disease, the Chinese University of Hong Kong. Today, I'm pleased to give you an overview of our study about aspirin use and the long-term risk of lower GI bleeding and serious cardiovascular events that will be published in Gastroenterology. Our study entitled Risks of Bleeding Recurrence and Cardiovascular Events with Continued Aspirin Use After Lower GI Hemorrhage. Among aspirin users with cardiothrombotic disease and a history of lower GI bleeding, there are two important clinical questions. First, what will be the risk of recurrent lower GI bleeding if they continued to use aspirin? Second, what will be the risk of serious cardiovascular events if aspirin is discontinued? This was a single-center retrospective cohort study conducted at the Prince of Wales Hospital, which serves a local population of 1.5 million people in Hong Kong. We identified a cohort of patients with aspirin-associated lower GI bleeding between year 2000 and 2007 from a prospectively collected GI bleeding registry. After the indexed lower GI bleeding, eligible patients were divided into two groups according to their cumulative exposure to aspirin. Patients receiving aspirin for less than 20% of the follow-up period were classified as non-users, whereas those receiving aspirin for at least 50% of the follow-up period were defined as regular users. The primary endpoint was the cumulative incidence of recurrent lower GI bleeding in 5 years. We excluded those with bleeding due to hemorrhoids, colorectal cancer, or upper GI bleeding. Secondary endpoints included serious cardiovascular events such as myocardial infarction, stroke, or death from a vascular cause. The other secondary endpoint was death from other causes. We screened 396 aspirin users with overt lower GI bleeding. 295 were eligible patients, and 121 were regarded as non-users, and 174 were classified as users. This is the primary endpoint. In terms of recurrent lower GI bleeding in 5 years, we found that those who continued aspirin had a significantly higher incidence rate of recurrent lower GI bleed, 18.9% in 5 years compared to 6.9% for non-users. The difference is significant. However, in terms of serious cardiovascular events, we find that patients in the aspirin group had a significantly lower incidence rate of serious CV events, 20.8% in the aspirin group compared to 36.9% in the non-user group. In terms of death due to other causes, again, aspirin group had a significantly lower mortality than the non-aspirin group, 8.2% among patients who continued aspirin comparing to 26.7% in the non-user group. So in conclusion, among aspirin users with a history of lower GI bleeding, continuation of aspirin increases the risk of recurrent lower GI bleeding by almost 3 times, but reduces the risk of serious CV events by 40% and other causes of death by 70%. Thank you for your attention.